Hello and welcome to New Life show on AUK Radio. I'm your host, Yinka, and this is your community for health and well-being and every other thing in between. Now, on today's show, I've got a special guest to talk about one part of our body that many of us take for granted, and that is our eyes. It is said that the eyes is the window to the soul. But the eyes is also virtually important for our health, from blurry vision to digital eye strain, watery eyes, diabetic eye issues. All of this matters. So whether you're like me that wears glasses, contact lenses, or you just want to see more clearly, well, this show is for you. So let's get right into it. Now, on the show, I have with me a special guest who is an optometrist, Dr. Osa Aghedo. Welcome, Dr. Osa.
Thank you. Good to be here. Thank
Welcome.
you so much.
Thank you for accepting our invitation again to be here. So I'm going to read a little bit about Dr. Osa because when she sent me a bio, it's quite long. So you know the woman has been in the business for a long time. So here is the short version of your bio, Dr. Osa. So Dr. Osa Aghedo is a passionate worshiper, minister, and doctor of optometry, practicing in both Nigeria and in the United Kingdom. She co pastors Kingdom Gospel Church with her husband and leads the women ministry. A highly graced woman international, she's also the medical lead of the Unique Women International. She's known for her heart to serve. She mentors professionals, supports women through faith and health, and of course, leads the medical team at the Unique International Women, which I'm also part of now. So, welcome on the show again, Dr. Osa.
Thank you. Thank you so much.
How's your day been?
Oh, very good. Yeah.
Looking
So yeah,
lovely
I had
as
a good
always.
one. I wasn't out like you that had to be stuck in the traffic.
And 25.
I know.
Interestingly, I rarely get stuck in traffic on the M25, but today was an exception.
Oh,
So, at least we made it here.
well, it happens.
So, can you tell us a little bit about why the heart, sorry, not the heart, the eyes is important to our health?
The eyes are very important, just like you said, is the window to the soul. Is very important. I've got patients that tell me that I prefer for other parts of my body to be dysfunctional than for my eyes because it's like a light to the body. If the eyes is gone, you're going to be more dependent on people, and yeah, generally a lot of things are just going to be shutting down.
Mm,
That's
mm,
basically what happens.
yeah,
So it's the light. So it's as if you're living in darkness
yeah,
without the eyes.
mm, mm. Wow.
Yeah.
Yes, obviously, it's vitally important because, imagine when you shut your eyes and you're trying to feel around the room or something.
To feel, especially when an environment that you're not used to. So you now
Exactly.
become, yeah. So you feel that see people, they're not depending on people, taking them around or
Mm,
things like that.
mm,
Yeah, even with one eye, at times it's difficult. Not to talk about both eyes gone.
yeah,
Yeah.
yeah. I laugh because today's Friday, right?
Yeah.
On, I think it must have been Monday, I woke
Yeah.
up with my left eye. I think I told you about this actually.
Yes, you
That
did.
was swollen. I tell you, it's not joking matter. Trying to drive with one eyelid
Oh,
swollen,
oh. You
it's
can
hard.
imagine.
It's hard. And I was working on the computer and I was training. It got to a point I said to my manager, I said, listen, I need to take like an hour away from the screen. And you know what I
Oh,
did? I actually went to bed.
that's good.
I had to go sleep. So yes, I can tell firsthand. that the eyes is vitally important.
That's it. It is. A little
Vitally
pain here
important.
and there, it
Mm.
just disorganizes the whole
Yes.
body, really,
Yeah.
because
Yeah.
it's connected to the other parts of your body. If you're having
Absolutely.
an eye ache, you're tired, you just
Mm.
don't want to do anything, you just want to relax, you want to sleep off something, you just want to do away with things you're doing that you have to concentrate.
Mm.
Without the eyes,
Absolutely.
you can't really concentrate, you can't read, you
Yes.
can't see what
Yes.
you're doing. There's a lot of things that are involved with the
Mm.
eyes, so it's very important.
Yeah. Try closing one eye and try to do the same thing. It's a tall
Exactly.
order.
There you go.
Wow. Right. So I have some questions for you about
Okay.
our eyes and how to look after our eyes so we
Yes, sir.
can see clearly, really. So, first question is: are there any eye conditions that are more common, especially among Afro Caribbeans or the Asian community, in comparison to people of other races?
Yeah, thank you. That's a good question. Yes, there are. You've heard things like glaucoma,
Mm-hmm.
especially open angle. There are different types of glaucoma. That's very prevalent among the Africans, and
Okay.
cataracts. I
Mm-hmm.
think the weather has to play a lot of role with that.
Okay.
Yeah, so a lot of eye infections. You're talking about trachoma, so many things that, especially in the rural areas of Africa.
Mm.
But even the generally, we've got glaucoma, I've got macular degeneration, got
Mm-hmm.
cataracts.
Yeah.
Those are
Yeah.
quite prevalent among the Afro Caribbean and the Asians compared to the Caucasians.
Mm.
Yes.
Mm. So you think our weather has, I mean, it's one of the factors why it's higher in the African communities.
That's yes. We've got a lot of
Mm.
infections, a lot of dust, lot of wind. Yeah,
Mm.
from the part of Africa I come from, we've got this red sand that, oh my God, when it's blowing, and at times you think once you get into your eyes and all of that.
Yeah.
Yeah, so the hot weather, you know.
Mm-hmm. Mm-hmm. So would you say for African diaspora, I beg your pardon, is it the same or is it different?
It's actually is lesser, let me say something like
Okay.
that, because
Okay.
a lot of us came from Africa and we came
Mm.
to diaspora. Even for those that are born here, maybe
Mm.
you go to hot countries and this once in a while.
Mm.
Yeah, it's lesser, but it's still prevalent among the Africans here.
Okay.
Because when I look at them, it's okay, African, yeah, you can tell from their eyes at times, especially the white part of the eyes as well. We've got what we call pterygium, that like the white part of the eye going a
Mm-hmm.
little bit of um, raised area on that side. So it happens more with the Africans. So when I say that, I was like, okay, yeah. Then I try to
Mm.
explain. Yes, it happens as well, but it's more common with the people at home. We find out that you
Okay.
just see the growth of the pterygium. It can become a pinguicula, becoming a pterygium. That's just the raised part of the eye, going from the white part, crossing to the black part of the eye. Yeah.
Wow.
So I would say
Wow.
it's less common here
Yeah.
for those that have stayed here for years.
Mm.
But
Mm.
for those that migrated, maybe they've stayed in Africa 20, 30 years, 15 years.
Mm.
Yeah, it's bound to be also there. It grows with time. It's just the
Yeah.
general, especially with the cataracts generally. So you
Mm.
see people in their 30s and their 40s, they're already getting cataracts. Whereas the
Wow.
Caucasians, they start from like 60.
Yeah. I used to think cataracts was an old people's, health condition, but or eye condition rather. But now you're saying it can also occur in people younger.
Yeah, especially the Afro
Mm.
Caribbean population. Yeah,
Okay.
it's earlier. I've seen 30 years old, 40 years old Afro Caribbeans having cataracts, but it's
Wow.
supposed to be an anomaly of age.
Mm-hmm. Mm-hmm.
But
Mm-hmm.
because of the hot weather we have and all of that, so it develops earlier. So
Mm.
over here, people from their 60s and so, oh, I have cataracts. Yes, normal. Yeah,
Mm.
60 and above. I said, we of African descent. A
Yeah.
lot of us get it from 30 upwards,
Wow.
although he's not ready for anything to be done, but you just know
Mm.
that, oh, this person have the beginnings, the signs that are
Yeah.
there. You have the cataract. Yeah.
Okay. And for the benefit of our listeners, what exactly is cataract?
The middle part of the eyes contains what we call the lens. It's like when you have a camera. So those ones, if it went from birth, it should be transparent so that light
Mm-hmm.
can come through the front as you're looking at things. The rays of the light can come through the front of the eye all the way
Mm-hmm.
to the back. So
Mm-hmm.
the lens is at the middle part of the eye. So as we age or when anything happens to what we call cataract, it becomes blurry.
Okay.
It becomes to, and that happens with age, just like I said, or when the sun is too much, it now begins to grow. There are some things now growing to cover it up. So that's what we call cataract, when the lens of the eye not is not as clear as it's supposed to be. It becomes
Oh.
more, there are things on it. It's like if things are growing on it,
Mm-hmm. Mm-hmm. Wow.
opacities.
Yeah.
Yes.
Yeah. So
So
it's
the
like
eye should be clear so
mm-hmm.
light can go in. So that's why some people say they can't see and all of that because the middle
Oh.
of part of the eye is getting blurry.
Mm-hmm.
Things are,
Mm.
they're getting some coverings on it
Okay.
in a layman's language.
Yeah. 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 So that's why the vision gets blurry or darker, and people are saying they can't read properly. Yeah.
One of those causes, but there are other things that causes that. It also maybe the muscles are weak.
Mm-hmm.
That's different, yeah. Because children
Okay.
can start wearing glasses, doesn't mean they have cataract. But the other
Okay.
parts of the eyes, maybe the muscles, the things that control the eyes opening and
And
closing
closing.
and everything like that, if
Mm-hmm.
those ones are weak, so
Okay.
that's where glasses come in to help with the
Yes.
eyes. Yeah. Mm.
Okay. Thank you for that. But I'm gonna ask a question in relation to the weakness of the muscle. Are there exercises? I'm a fitness coach. So when I hear muscle, I'm thinking exercise. Do we have eye
Exercise,
exercise that we
yes.
can use?
Maybe when we're younger, because a lot of people say that, say, oh, I don't want to wear glasses all the time.
Yeah,
I'm doing some eye exercise.
yeah.
There's actually no exercise that can help with that.
Oh, so we're
Yeah,
stuck
there's
with this.
actually no exercise. Yeah, some people say, oh, I don't want to wear glasses, so I'm doing this exercise. They told me in this, I'm opening my eyes, I'm closing it, I'm blinking a lot. I
Mm-hmm.
said, no. Maybe when we're younger, maybe from age, when beginning to under eight, from maybe day 1 to 8, 8 years old, then maybe if we feel that, oh, the muscles of the eyes are weak or they are
Mm-hmm.
looking away, they're not looking straight, both eyes are not coordinating, then we can do eye exercises that can bring the muscles together. From that age upwards,
Mm-hmm.
either you have your glasses or you have surgery done. It
Okay.
depends on the eye condition. Yeah, so
Wow.
there's actually no eye exercise that can do that so that you can't wear glasses anymore. Because I hear that a lot. What can I do so that I don't wear glasses at all?
Yeah, a lot of us can wear it. We don't want to wear
Yeah.
any. So you said doing exercises between age, 1 or till about 8.
Hmm.
So perhaps teaching our children to do eye exercises might help them later on in life.
Hmm.
What do you
Those
think?
are exercises really is when we find out there's a defect in their
Okay.
eyes.
Okay.
Otherwise, they don't need any eye exercises. So this kind of exercises, maybe you've heard about a squint or a
Mm.
lazy eye.
A lazy eye. Right. Yes,
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 that's what
yes.
we call squint. Yeah, one eye is looking straight, maybe the other one is wandering away. It's
Mm-hmm.
just lazy. So on that age, we can be able to train the eyes. Maybe you see some people they have to patch one eye, the good eye, to train the
To
lazy
do.
eye.
Okay.
Yes. So from age 8 and above, the muscles are already developed and it's difficult to do that. Yeah, so
Mm.
it's only when they have a defect. So don't do any exercise with any child. Please just come take them for regular eye check. We can leave the rest to us, the optometrist.
It was just a thought.
No, don't
That
worry about the
maybe
exercise.
if we are able to exercise our bodily muscles, we could
Yeah.
maybe Help the eye muscle as
Maybe the
well.
eye muscles. Nah, it doesn't work that way.
Well, I tried. Thank you. Okay, so for example, like I said, using myself as an example, that
Mhm,
wearing glasses, I didn't really want to be wearing glasses, and I
mhm.
often hear my daughters say to me, "Your mom, you where are your glasses? You need to wear it. Otherwise, next time you go, you have a stronger prescription." Yeah.
Exactly.
So I find many people in our communities they
Mm,
wear contact lenses or fashion glasses. What would
mm,
you say are the risk of using non-prescribed lenses or perhaps even buy glasses online?
mm. There's actually not much of a risk as long as you're not non-prescription. Yes, some people wear cosmetic contact lenses. As long as they
Okay.
clean them, yeah, they wash their hands, it's fine.
Mm, mm,
Because you see some people in the show industries, they have to models and all of that. They have to wear them. At times, we even get them prescribed and give them. Oh, do you
okay.
want hazel eyes? And those days it used to be like we have trials, but now it's a bit restricted because of
Mm,
some infections. But if they take care of it well, it's
mm,
fine.
okay.
What was the other thing we were so talking about?
Yeah, I said
Not they're buying glasses online.
online. Yes.
I advise a lot of people because some have come back with problems, but
Mm-hmm.
a lot of the eye clinics now they are doing online. So what you can do, we can get the measurement for them. There's a particular measurement they need for
Mm-hmm.
them to get
Mm-hmm.
the glasses online.
Mm,
Yeah, so if they get it right, and they need to be careful with the online providers are the
mm,
glasses, because at times they've come back with problems. Because it's better, I always advise them, if you can, is less expensive to get
mm-hmm.
online.
Mm-hmm.
But if you can't afford it, come to a canine clinic. We'll do pressure proper measurements, especially for some specific kind of glasses that are
Okay.
very sensitive. We have
Mm,
specialized dispensing opticians that
mm,
should do the measurements, which online will not be able to
you
do. They will ask you for it
mm-hmm.
because they
Mm-hmm.
can't do any measurement online. You now
Of
send
course.
all the measurements that they need. At times
Mm,
it doesn't come out right. So they come back
mm,
to us.
yeah, yeah. Wow. All
We
right.
gave the prescription, he went online to buy it, and they're having problems. Like,
Mm-hmm.
that's all the problems you have with online.
Mm,
But if they
mm,
are able to get the measurements for you, we do all the measurements and you're able to take it to the online, fine.
mm,
But
mm.
that would be somehow a breach of some kind of agreement there. So because
All
they want,
right.
when you come to an eye clinic, yeah, you can take your prescription. Yeah,
Mm-hmm.
it's allowed
Mm-hmm.
in the
Yeah.
UK. They're allowed to
Okay.
give somebody after you finish with an eye test. They request for their prescription. Is
Yes.
generally you should
Yeah.
always give a prescription. But
Mm,
when they go online, there might be some problems, especially with
mm.
measurements.
Okay.
Yeah, some people have been good with that. It's
Yeah.
come out well.
Yeah.
But there are some that have some, maybe a stronger prescription that you have to really tailor made. Yeah,
Maize. Okay.
yeah,
Okay.
the
Okay.
glasses. So
Yeah.
online, it wouldn't be too good for that,
For the okay.
because they are not going
Yeah.
to do all the measurement. They have to wear the glasses. We
Mm,
have to put some measurement, dot the lines or where your eyes, the pupils are to the other one, measure down and all of
mm.
that. So
Yes.
yeah, you won't get that
Okay.
online. So it's not all prescription that you just say, oh yeah, just click online and go and
Mm,
get.
mm. Okay. So,
People should
in
be
other words,
careful.
if you
Be
have
careful. Be
be careful.
careful.
That's
Yeah.
it. That's it. All right. Well, thank you for that. So, another question. So, how do conditions like diabetes and hypertension, which is quite prevalent in our
Hmm.
communities, impact on
Hmm.
our eye health?
Okay. Did I mention diabetes then for the ethnic, the Afro-Caribbeans? I did say glaucoma.
Yeah, we
Diabetes is
mentioned that.
another
Yeah,
thing that's very
yeah,
prevalent. Yeah, diabetes is very prevalent.
yeah.
So, um, diabetes, as we most of us know, is when maybe blood glucose level, insulin, and everything is playing up in the body. Let me just say
Mm-hmm.
it. So just to let you know that every part of the body is connected. So whatever
Absolutely.
is doing some happening somewhere else is somehow going to affect the other part
Mm-hmm.
of the body.
Mm-hmm. Mm-hmm.
So diabetes that is not being monitored carefully can affect the eyes.
Mm.
The
Mm.
blood, the blood vessels that are bringing nutrients into the eyes are disturbed. So that's why people, we have people come for an eye test. There are some people that didn't even know maybe they had diabetes or not. When we check the photos of the, because the eye is the only place you can actually see the blood vessels and see what's connected. Even the
Mm-hmm.
blood vessels coming from the brain into the eyes and from the eyes to the
Wow.
brain, everything is on the camera. So
Wow.
things can start showing to us that, oh,
Mm.
there's something going on somewhere. Well, that's
Yeah.
okay. Please go and do a blood test. Go to your GP
Mm.
because the blood vessels are disturbed. They are supposed to be going like smoothly and all of that. You start seeing maybe splashes of like inflammation some places at the back of the at the background of the eye, and you're seeing
Mm.
maybe the blood vessels instead of Lawrence stage they are tortuous, like look kind of. So we tell them hypertension is another thing that's quite
Mm-hmm.
prevalent. So we're like,
Mm-hmm.
when did you have your blood pressure check? So they're like, oh, I've
Mm.
never checked or I've not checked for years. Please go to your GP, do a full blood test. So that's how
Wow.
some people have discovered they've got diabetes
This. Wow.
and their vision becomes start blurry if it is not treated.
Mm.
There are
Mm.
people that are living with diabetes 20, 30 years now, is not affected their eyes in any
Mm.
way.
Mm.
It is well controlled.
That's right.
But if it is not well controlled, it can affect the eyes because the blood vessels that are coming, they are being blocked, and
Mm.
there's a way the vessels of the eyes they try to treat to fight whatever is coming to help the eyes because there will
Mm.
not be um, leakages of the
Mm.
blood vessels that are bringing the eyes, the nutrients to the eyes. So you
Mm.
start seeing everything like blood splashes and little tiny blood vessels trying to help the eyes,
Wow.
and they start bursting, and they will now like just like you see red eye in the
Mm-hmm.
front of the eye. At times
Yeah.
you now start seeing redness all over the background of the back of the eyes. So
Wow.
you know that, and they start complaining of blood vision. They can't see clearly and things like that. But if the diabetes is well controlled, it
Mm.
doesn't affect the eyes. Yeah,
Wow.
blurriness, foggy vision, so many things start playing up
Mm. Mm.
at the
Wow.
eyes. Their means their glucose have not been controlled.
Controlled.
So
Yeah.
these things are affecting the eyes. The
Yeah.
nutrients are not there.
Mm.
Yeah.
Just
So
from an eye test
yeah,
to discovering that the person's got diabetes. So
yeah.
it points to the importance of having a regular eye test, isn't
It's
it?
very important. I
Mm.
cannot overemphasize it. There are
Mm.
people that have had brain tumor just coming for general eye test.
Wow.
We just looked at it and it's like, oh, there's something going on here in your brain. You need to go. Funny enough, this happened yesterday. I was with a
Mm.
colleague and she came to me, Usa, please, can you check this photograph? Was like, she was like, don't scream out. I was like,
Wow.
this person did not have any pain because normally this kind of thing that was happening at the back of the eye supposed to have pain. She said, no,
Wow.
it's just a routine check. I said, you are going to do this an urgent referral. The optic disc at the back of the eye, where blood vessels, just like I said, brain and the eye, it was so raised that the blood vessels we couldn't even see them. So there's
Wow.
definitely something happening in that person's brain. So it was going to be an emergency referral.
Wow.
She
Wow.
just
Wow.
called me. She didn't even, there was no sight. I just looked at it. We looked at the other eye. I said, you're gonna this is an urgent referral. Straight on to the yeah.
Wow.
So that's
Amazing.
what we see. Some people you don't have pains. That's why
Mm.
I always encourage people. Not until when you see pain.
Mm.
Pain is already like, oh, something has even gone beyond.
Mm.
Regular checkup is very important. There's so many things that we can detect.
Yeah.
That person now, there's somebody I did as well one time. The lady came back to tell me, "Oh, thank you so much. The mom that is being treated had the brain hemorrhage, the brain damage.
Wow.
Yeah, so she's going through that. She was just telling me, oh, my mom complains a lot. Just check down, let's go. I was like,
Mm.
when I checked, I said, she needs to go to the hospital now. Oh, we thought
Wow.
she's always complaining though. So we just said, okay, for just let's just take you to the eye hospital. I said, thank God you did. And she came back to
Wow.
thank me that the mom is receiving her treatment now. Yes,
So
brain
can you
hemorrhage and
imagine
all of that.
if that had gone?
Yeah, she
undetected.
would have. Some of them have. They've lost. We have actually lost some people like that. Yeah, they didn't come. Yeah, those are just, I mean, extreme cases. Yeah, or now they had a brain damage. They're not suffering from stroke and things like that. Yeah, high hypertension and everything that there's not taken care of. Yes, stroke. Yeah, stroke.
Wow.
That means the eye is gone. Some people they can't see properly. You have to be taken
Wow.
around and led about by people. Yeah, it's
So
one of those things. Yeah.
please tell us again how often we should have eye tests. I
Right.
know
So
you
in
talked
the
about why,
yeah,
but
okay, in
yes.
the UK here, under 16 should be like a yearly checkup.
Okay.
Then from 16 to like 59 to every 2 years.
Okay.
Then from this even the 70 and above, we can say every year.
Mm-hmm.
But at times there are some people that come 70-year-old, their vision is beautiful, the eyes of
Mm,
the back of their eyes is fine. So we're now beginning to say, okay, let's see you back in 2 years.
mm.
But a lot of them they would have developed some things at the back of the eye, what we call macular degeneration,
Yeah.
maybe
Yeah.
early cataract. So it's okay. Or maybe the cataract is getting worse. Okay, we'll monitor you for a yearly checkup. And anybody that has a family history of glaucoma from 40
Mm,
years and above is a yearly checkup because
okay.
it can is hereditary.
Hereditary. Mm,
Yeah,
mm,
glaucoma. So anybody from that age, then or people with maybe ocular hypertension, just like you
mm,
have high blood pressure, some
mm-hmm,
people can have high pressure of the eye. We call it ocular hypertension, and
mm.
if they are not being monitored in the hospital, so we the
Okay.
optometrists can see them yearly just to
Okay.
monitor it. It's not too high yet for anything to be done.
Mm,
Yeah,
mm,
so
mm.
then children under 7, maybe they wear glasses and their prescription is increasing every 3 months. We have to see them every 6 months.
Oh, wow.
Children under 7, yeah. So it depends on the age gap and if you come for an eye test.
Mm,
And so some parents to hear they ask also should I bring my child in? Your
mm.
child can even be seen as early as 1 month, 2 months, but not with the opticians. Normally would be in the hospital. So
Okay.
anytime you detect anything, the child is blinking too much, they are going close to the TV. But
Mm,
normally in the optometry test, clinics, we've said maybe from 4 and above. That's when they can read the letters. But we've actually seen some 2-year-olds as well before.
mm,
Yeah, we
mm.
just want the complaint, just do what as much as you can do. And
Mm.
if you have to refer them to the eye hospital because they got a lot of things on the hospitals that they can use. Yeah.
Wow.
So it depends on yeah.
Eye is
So
a big
every
deal.
year, every 2 years, every 6 months, it depends on the age
It's a big deal. Big deal.
age
Big
group.
deal. Wow. Well, thank you very much for that. I
Right.
probably should have asked you this before. So,
Yeah.
who's an optician and who's an optometrist?
Okay. I think here they is it's something that they've mixed up.
Mm-hmm.
We are optometrists. Optometrists are the primary eye care providers.
Okay.
So anybody that have an eye problem comes to an optometrist first
Mm,
before you go to an ophthalmologist. In fact, the optician is the name that has not been used generally.
mm-hmm.
Here, you can call us ophthalmic opticians
Okay. Ophthalmic
who are
optician.
optometrists. So, is that
Optometrist.
optometrists or ophthalmic opticians?
Okay. Okay.
Then we have the dispensing opticians. So, when the ophthalmic optician finishes, we hand over to the dispensing. So, they dispense the glasses.
Mm-hmm.
We're talking about measurements and everything,
Yes.
and that is their area. So they pick
Okay.
out to help the patient or whoever pick the frame. Oh, this is nice on you. Okay, that's fine.
Mm-hmm.
This is one you want. They will now do the measurements
Okay.
and do other checks that they need to do with the glasses. Those are the dispensing opticians. Then we have the optical assistants, which are the ones that welcome the patient. They
Mm-hmm.
do the pre-screening. That's when they take them to the room, do all the and check their photo, do the photograph, do
Okay.
the first part of the whole thing. So
Mm-hmm.
opticians is what they now use generally here in the UK, which
All right.
in fact my colleagues back home and the America they don't like hearing that. One of them told me that, oh, sir, you're not an optician, you're an optometrist. Let them get it right. I said, I think maybe they can't pronounce it. That's
Optometrist.
why they just leave us. So now, optometrists here in the UK are called opticians.
All right. Okay.
Yeah,
Got it.
but we are actually the right name is we are optometrists.
Optometrist.
And you have the ophthalmologist that does the eye surgery. So
Aha.
those are the ones who correct maybe lazy eye or these
Mm-hmm.
things that we're talking about now. That
Cataract
the
removal and
lady
all that.
patient that we're talking about that had those defects. Yeah, we send them off to the ophthalmologist, and they have the different sections there. People that can deal with different parts of the eyes. Yeah, so we just accept it as opticians. Yeah, they call us
All right.
opticians. We go with that. We are
Mm.
optometrists.
Okay. Well, thank you for clarifying that. Because I've always wondered, like, optician, optometrist, ophthalmologist. So
It's the same
now I
here now.
know.
The music of just yeah, we use it as opto. Yeah, we are opticians. That's fine.
Wow.
I'm going to my
Okay.
opticians. Yeah.
Opticians. Yeah. Okay. So one of the other questions I was going to ask you was about parents. So,
Mm,
what should parents know about eye screening for children, especially if there's a family history of eye issues?
mm. They should bring them on time for checkups. Just like I was saying just now,
Mm-hmm.
even they can notice it from as early as a month old or 2 months old.
Mm-hmm.
This child is doing this and all of that. They should once you observe your children and bring them for an eye test. There are some children that the last and one of them I saw that how old are you? 15 years old, your first eye test. I was like, oh, blame mommy. And the mom, yeah, I'm sorry. Because they never complained. I said,
Mm-hmm.
no, as early as 4, if you can, if they don't complain. But if they are complaining or you see them, at times, so a lot of parents have had to apologize to their children. You
Mm-hmm.
see them reading and they are bringing the book close, so close, or they are going to the
Yeah.
TV so close. That should give
Mm.
you a sign or something
Mm-hmm.
that's,
Mm-hmm.
oh, this is not right. They can't
Mm.
see.
Yeah.
But a lot of them think, oh, they just want to wear glasses. I tell them, leave that to us. We know those that are pretending. We have ways of finding out. So please, from age 4, if there's no complaints, bring them to the optician.
Mhm.
Yeah, I'm using that word opticians now. Bring them
Yeah.
to the optometrist.
Well, that's the one
But if
most
you have
people are
any
familiar
problem,
with.
still bring them. We've had 2-year-olds in the
Mm-hmm.
clinic. They can't read whatever the chart, but there we have other equipment we can use and say,
All
okay, if
right.
there's something there, you can quickly then send them to the hospital. They refer them from there, or just to assure the parents, oh, it's okay. Yeah. So
Especially if
there's
there's a
no age.
family history, it's
If
still
there's a
good, I'm
family
guessing.
history, especially maybe people that wear glasses a lot, they are
Mm-hmm.
short-sighted, and you do just like I said, you notice all these things. And another thing I need to be grateful for, the schools are also picking it up now.
Mm-hmm.
They are
Mm-hmm.
doing eye tests in schools, which is
Mm-hmm.
we're very grateful for that.
Yeah.
A lot of the patients don't know the difference, they didn't even know. They just, oh, I thought the child they just want to read, they just bring things closer. So the schools now are picking on them, they're doing this a test where they read letters and all of that. So a lot of them are now coming, they write to the parents and tell them, take them for an eye test. So
Mm.
that's how a lot of people are detecting now that, oh, their children need glasses.
Mm-hmm.
Yes,
Mm-hmm.
so
Excellent.
it's very important. Family history is a
Mm-hmm.
very strong
Mm.
one. A lot of the children that are wearing glasses today is hereditary. Because, oh, you
Yeah.
see, because they're spending too much time on the
On
computer.
screen.
And yeah, I said one of it, but mostly it's hereditary. How many of you were, oh, the other every one of us, oh, or maybe just the dad, oh, just this one. I said, that's it. That's why. Yeah, even if there's no family history, please bring your children for a
Oh,
regular checkup.
yeah.
Yeah,
Excellent.
it's very important.
Yeah. Thank you. So going back to our community,
Hmm,
like some older members of our community avoid eye surgery due to
hmm,
fear, cultural
hmm,
beliefs. How can we address these concerns?
hmm. Yeah, that's a very that's something that's affecting a lot of people at the moment.
Mm-hmm.
Some of them got, let me just, okay, basic one, cataracts for
Yes.
the elderly people.
Yeah.
The cataract is matured. What they do, maybe somebody else, a friend had it before
Mm.
and they had problems with it.
Yes.
So I'm not going to do any cataract. There's no way you can convince these people. Some of them will say, oh, somebody did it and their eyes, they've
Yes.
gone blind now. I said, look, there's risk in everything in life.
Yes. Yes. Yeah.
Yes, really going to be out there among the few percentage that is supposed to, the ones that it happened to. So I
Mm,
would say, please don't be scared. Come for an eye test, and if you have to go for a second opinion, which a
mm-hmm,
lot of some people now do, okay, you've said your own. I'll go and pay or something else to have a second opinion with another optician. It's better than you just staying away to say I don't want to do it. And I'll tell you, there are some that have gone and they come back so excited.
they can
They've
see
done the
clearly.
cataract. I can see now. It's so clear. The things I couldn't see. I say, you see, it wasn't even up to 30 minutes. I say, no, that's
Mm,
it. But there are some other higher implications. I tell them they will do one eye first. If it has to, if
yes.
it's affecting both eyes,
Mm,
they will do the surgeons. They will do one eye. They'll tell you, come back to your optometrist.
mm,
If it's good or fine or something like that, then we'll go ahead with the other one.
yeah. Yeah.
So the risk involved is very minimal.
Minimal.
Yes,
Mm,
sometimes it goes wrong, maybe because of underlying issues.
mm-hmm,
The elderly people, they have other problems with their systemic problems and other bodies and all of that. It affects the operation. But for you to just say, "Oh no, I don't want to do it," or "I want to go herbal," especially with the
oh yes.
African people, I
Herbal.
want to go help her. I just want to, I'm not going to. I read this on the internet. They said, somebody came to me the other day. Oh, yeah, they said it's cataract. I was just applying one of these, there's a drug they said I should come and buy. They'll just put it on it and it will just fall off. I had to plead with her, see the same very. I said, please, cataract is by operation. Don't let anybody deceive you. You're just going to spend your money. You're just going to eat your money. There's
Mm-hmm.
nothing like that. Yeah, they say you just rub I think she said like a drop on it and the
Mm.
cataract will fall off. Oh, I said,
Wow.
please,
So
please,
just one
please.
drop and the cataract will
Yeah,
be gone.
I think maybe they said for a few times because I think the person, I was thinking, these people really want to make money. They say, yes, if you use it within some times, you don't have to now go for surgery, the cataract will fall off. So
Mm.
that's the things we are fighting with this
Yeah.
year. Some people
Yeah.
say, no, no, no. I'm doing my own herbal things now. I'm rubbing things on my eyes and it's helping me. So I just try to say, please be careful. You have just the two of them in front of you. Anything happens to them, it's gonna be something else. Yeah. So we try to just there are some complications that have gone wrong. But I wouldn't say they should stay off. They should try
Mm.
come and we'll discuss it and they will tell you the risk involved
Yeah.
when you go for the surgery. What is the risk involved? Okay, I don't want to go through it, that's fine.
Mm. Mm.
And they won't force you,
Yeah.
but most times it's very good success rate of surgery.
Yeah. So how many sorry, many people think that vision loss is just part of aging.
Mhm.
When should someone see a specialist about a blurry vision or discomfort? We probably touched on this before, but
Yeah, you should go immediately
yeah.
if there's anything blurry, any discomfort, or
Mm.
maybe even just it feel like grit in my eyes when I'm blinking or
Mm-hmm.
something like that. Don't wait.
Mm.
So there's something, your eyes are telling you something now, that there's something
Yeah.
happening somewhere
Mm-hmm.
that you need an attention.
Attention. Yeah. Pay attention to it.
Yes.
Mm.
So that's what pains me. Like some people wait till that time. If you do your regular checks, and in
Mm.
between there's something like that, fine, because there are some times some have come that will find out that sorry that that eye is gone, or sorry you
Wow.
cannot see with that eye. They're like, oh, he's been there for a while but I
Mm.
just
Mm.
ignored it. That's why I tell people, even if you feel you're going to look stupid before the optometrist, oh, I just had an eye test 2 3 months ago, this happened, please don't wait.
Mm.
Anything
Mm.
discomfort, that means there's something going on in the eyes. Anything blurry. I remember a relation of mine 3 years ago. He just called. I said, oh, she's seeing something like shadows in her eyes. I knew that
Mm-hmm.
was a very serious thing. So I
Wow.
had to call my colleagues back home and all of that. But it was already an end stage glaucoma.
Mm.
That eye is gone. So she can't see with her periphery now. So when she's walking on the road, at times she can trip over things.
Wow.
Somebody like that can never drive anymore because your peripheral vision is gone. That's what it
It's
does. It
gone.
gives you a tunnel vision.
So you can't see
So tunnel, you can
sideways.
see only straight ahead. Periphery is
Okay.
gone. So somebody can be coming from your periphery now. You wouldn't even know. Or a car or anything like that. You just walk into things.
Wow.
Yeah.
Wow.
Until
Okay.
that stage, she's never had an eye test
Mm-hmm.
for a long.
Mm-hmm.
When they sent me the picture of the back of that eye, I was like, whoa.
Wow. Wow.
You see, because she was not starting to see things like smoky vision. He said, I see smoke in my vision. Ah, I knew that there was something already so bad.
Mm.
Yeah, so now she's going to be on drugs for the rest of her life. At least the drugs
Mm.
will control it to an extent. Yeah,
Mm.
so that's why don't wait till something happens.
Wow.
There's some people they just that eye was is already gone and she the other day she said she fell because she couldn't see
Mm.
things at the side. I said yes, you
Mm.
have to be careful now. Don't just go out on your own like that anymore. And you still have a bit of vision, but it's straight on. Your
Wow.
periphery is gone, so you have to virtually be turning to see everything you look at. Yeah,
Mm.
all your
Mm.
periphery, you have to move your eyes. Yeah,
Wow.
so
Wow.
it's something that we say to people. They feel that oh I can't afford it, I can't do this.
Mm-hmm.
But the good thing in this country, you can go someplace you can afford. If you're on benefits or something like that, there's always something that they can do to help. If
Mm.
you can
Mm.
get clothes, you can buy things for other things, you can spare some few changes to have
Yes.
an eye test and let them tell you the result. It's oh very
Mm.
good, then it's fine. Oh, the
Mm-hmm.
discomfort, you need glasses. Oh no, I don't want
Yeah.
to wear glasses.
Mm.
Let's
Wow.
leave that. Maybe you ask that for another.
Wow. Wow. Okay.
Mm,
So bringing me to the last question.
mm,
How can we encourage better health habits in our community, especially with increase of well, we're on screen a lot more these days,
mm,
with poor lighting in some homes. So how can we
mm.
encourage better eye health habits?
Eat, eat well,
Okay.
not to nourish the eyes. I know you're in the health sector. A lot of the rainbow things, as they say,
Yeah.
rainbow food.
Yeah.
Eat healthy. Take care of your eyes. Wash the eyes.
Mm-hmm.
Because there are some people they don't do, they have a lot of infection things just hanging around the eyelids. So
Mm.
bathing the eyelids when you're taking your bath, you know, really taking care of your eyes. And just this
Mm.
computer screen we're just talking about now,
Mm-hmm.
having to take regular breaks from the
Breaks.
computer.
Yeah.
Yeah, a lot of people are having, you see, at the end of the day, your eyes are tired,
Tired.
you are
Yeah.
strained, you just want to do away with everything,
Mm-hmm.
there's soreness. Those are all
Mm.
part of what the computer, regular use of the computer. The computer on itself is not bad, but if you
Mm.
are on it for too long, so that's why I tell people take regular breaks. Oh, but I'm on my computer, I have to be like 6 hours. I say, okay, if
Yeah.
you can't get up from your desk, just look straight ahead. There's this
Okay.
what we call 20 20 20 20 rule.
Mm-hmm.
20 minutes on your computer, look 20
Look
feet
away.
away, blink 20 times.
Mm.
That can help, but at times it's easier said than done, as
Mm-hmm.
some people
Mm-hmm.
say. But
Mm.
yeah, if you have to, please take
Yeah.
care of your eyes. Some people even have the screen protectors and all of that. But
Yeah.
yes, those are the little things. Sunglasses. I cannot
Mm.
overemphasize that.
Mm.
The sun is out now. Some
Yeah.
people think it's a fashion. Oh no, 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 I don't wear sunglasses. And some people are very serious when they are telling me. And I'm thinking, I'm advising you not to please wear sunglasses. Oh, really? I just don't think I can wear sunglasses. I said it doesn't have to be very dark.
Mm.
Even if you get different shades, they are the ones that are tinted, they're the ones that are graded, and things like that. As long as you're protecting your eyes. Oh, they didn't really think that sunglasses, yeah, the sun is very damaging. It can
Mm.
damage your eyes. So sunglasses protect your eyes. Yeah. So just like I said,
Mm.
regular checkups is
Mm-hmm.
very good. We've
Mm-hmm.
talked about the different age groups. Go for your test. Then the optometrist will not tell you, oh, I'll see you back in a year's time. Why? Or
Mm.
because you've got a family history. You're over
Mm-hmm.
40, family history of glaucoma, or there's some things at the back of your eyes we need to monitor more
Mm-hmm.
regularly.
Mm.
Yeah. So regular eye checks,
Yeah.
eating habits, very nutrition, not food, because there are some people that have found that there's so many things like this macular degeneration we're talking about. It's
Mm.
like debris now packed at the back of the eye.
On the eye.
If
Oh
it
wow.
becomes now at the middle part and it start affecting the very middle part of the eye,
Mm.
that's what the one that that's concerned about vision, that we use for vision, then you start getting blurry vision. People
mm,
can even go blind from all of that accumulation of debris on that middle part of the eye,
mm,
blood vision. So my eyes are blurry. Yeah, if you come for the checkup, so regular checkups, eat healthily. That's why some people will have to tell them healthy dieting.
mm,
Healthy, if you don't even eat healthy, you're looking
mm.
at diabetes and things like that.
Yeah,
Yeah.
yeah.
So regular checkups, wear your sunglasses. I don't say
Mm-hmm.
wear your sunglasses in the night or when
Mm-hmm.
you are indoors.
But in the
Some people put
daytime while you're
when
out.
you just do a bright light, yeah,
Yes.
ultraviolet protect your eyes. People
Mm-hmm.
that drive and all of that, motorbike users and all of
Mm-hmm.
that. People that walk outside a lot in their gardening and all of that, and visors, some protective equipment for
Mm-hmm.
those that are builders, welders, and things like
Yeah.
that. You
Yeah.
must have your safety goggles.
Mm, mm.
It's an important thing
Yeah.
because some people they see that foreign bodies are flying into their eyes
Yeah.
and
Yeah.
everything is happening, arc
Mm,
eye, pain,
mm,
because you're not protecting your eyes. So
mm.
there's a lot of things we need to do. Protect
Yeah.
your eyes, go for regular checkup, eat healthy because yeah, also
Mm.
nourishes the eye.
Yes. Yes.
Yeah.
Absolutely. It's like the carrots when you cut it.
And the
It's a good for
carrots,
the
all the
eye.
things that contain vitamin A.
Yeah.
Oh yes, they are just good. Normal things, even the spinach, the kale,
Mm-hmm.
all the leafy vegetables,
Mm.
they are very good.
Excellent.
Yeah.
Well, that brings us to the end of today's show. Thank you
Okay.
so much for joining us, Dr. Olsa. And
Pleasure.
our listeners, you've heard it today. Your eye is the window to your soul. Let's look after our eyes so we can see
Yes,
brightly. And until
that's right.
next time, look after yourself. And remember, let's get wealthy together by staying healthy. Take care.